Question 1. Foundational knowledge and ethics. Which of the following ethical principles is most closely aligned with the concept of client-centered practice in occupational therapy? A. Beneficence. B. Autonomy. C. Justice. D. Non-maleficence. Answer: B. Autonomy. Explanation: the principle of autonomy refers to the right of clients to make their own informed decisions about their care and treatment. In the context of client-centered occupational therapy practice, this principle supports involving the client in decision-making and ensuring they have the necessary information to participate actively in the therapeutic process. Autonomy ensures respect for the client's wishes, values, and goals, which are components of a client-centered approach. Beneficence refers to the obligation to provide benefits to the client and act in their best interest, but it does not specifically emphasize client choice. Justice involves fairness in the delivery of occupational therapy services, ensuring equitable access for all clients. Non-maleficence means do no harm, ensuring that practitioners avoid causing harm to their clients, but it does not directly connect clients' active involvement in decision-making. Question 2. Pediatric occupational therapy. Samantha, a 4-year-old child with autism spectrum disorder, has difficulty with sensory processing, particularly with tactile defensiveness. During therapy, she frequently reacts to textures, such as refusing to touch certain materials and becoming visibly upset. What intervention strategy would most effectively address Samantha's sensory processing difficulties? A. Providing sensory diet that includes activities to help Samantha gradually tolerate different textures at her own pace. B. Encouraging Samantha to participate in group activities with peers, focusing on social interaction. C. Using behavioral reinforcement system to reward Samantha for tolerating certain textures. D. Asking Samantha's family to avoid any tactile experiences that might cause distress, keeping her environment sensory-free as possible. Answer: A. Providing a sensory diet that includes activities to help Samantha gradually tolerate different textures at her own pace. Explanation: a sensory diet is a structured set of activities designed to meet the sensory needs of a child, tailored to help them gradually tolerate various sensory inputs. In the case of tactile defensiveness in a child with ASD, using a sensory diet with activities like brushing, deep pressure, and textured play can the child adapt to different textures in a controlled and non-threatening way. Encouraging group activities. B. Focuses more on socialization and may not directly address the sensory issue. A behavioral reinforcement system, C, may be effective for encouraging adaptive behaviors, but it does not directly target the sensory processing deficit. Avoiding sensory experiences, D, would likely prevent the child from gradually adapting to textures and hinder sensory integration therapy. Question 3. Geriatric occupational therapy. Mr. Thompson, the 75-year-old man, is experiencing cognitive decline due to early-stage dementia. He lives alone and struggles with remembering to take his medications on time. His daughter is concerned about his safety and independence. Which intervention would be most appropriate for promoting his independence while ensuring his safety? A. Implementing a medication management system such as a pill organizer with timed reminders or an electronic medication management device. B. Recommending that Mr. Thompson move in with his daughter to ensure constant supervision. C. Limiting his involvement in household tasks to prevent confusion and stress. D. Encouraging Mr. Thompson to participate in memory training exercises only during therapy sessions without any reinforcement outside the session. Answer: A. Implementing a medication management system such as a pill organizer with timed reminders or an electronic medication management device. Explanation: for older adults with dementia, implementing a medication management system that includes tools like pill organizers or electronic reminders can help them manage their medications independently and safely. This allows the patient to maintain autonomy while ensuring they follow prescribed routines. Recommending that Mr. Thompson move in with his daughter, B, might be an unnecessary step if there are alternatives that support his independence and may not address his need for a structured approach to managing daily tasks. Limiting his involvement in household tasks, C, may increase his sense of dependency, which can negatively impact his mental health and well-being. It's important to maintain as much independence as possible. Memory training exercises only during therapy sessions. D, without reinforcement in daily life would reduce the effectiveness of cognitive interventions, as skills need to be practiced regularly in the natural environment to reinforce retention. Question 4. Clinical reasoning and critical thinking. During an occupational therapy assessment, you encounter a situation where a client, MS Green, who is recovering from a stroke, has difficulty with fine motor skills, particularly with gripping and releasing objects. After initial evaluation, you determine that she is able to grasp objects but struggles to release them, which is impacting her ability to perform activities of daily living adults. Based on your clinical reasoning, which of the following interventions would be most appropriate to address her specific motor skill deficit? A. Using a bilateral upper extremity strengthening program to improve overall muscle strength in both hands. B. Implementing a task-specific training program that includes activities focusing on releasing objects, such as holding and releasing a small ball or elastic bands. C. Providing adaptive equipment, such as a button, hook, or zipper pull to modify tasks and compensate for the inability to release objects. D. Incorporate neurodevelopmental techniques to facilitate improved sensory feedback and motor coordination, specifically targeting grip strength. Answer. B. Implementing a task-specific training program that includes activities focusing on releasing objects, such as holding and releasing a small ball or elastic bands. Explanation. The focus for MS Green's intervention should be on task-specific training targeting the specific motor skill deficit of object release. Task-specific training involves practicing the specific motion or skill that the client needs to improve, which is important in stroke rehabilitation. By practicing activities like holding and releasing ball or using elastic bands, she can focus on improving the release phase of her grip, which directly impacts her ability to complete adults. Bilateral upper extremity strengthening program A would generally improve overall strength, but it would not specifically address the difficulty with releasing objects. Adaptive equipment C could be compensatory approach. It may not help MS Green regain the motor skills needed for independent functioning. Neurodevelopmental techniques D would focus on general motor coordination and sensory feedback, but they may not specifically target the release deficit. Question 5. Psychosocial aspects of occupational therapy. Mrs. Rodriguez is a 62-year-old woman recently diagnosed with depression, which has been affecting her motivation to engage in daily activities, including self-care and social interaction. As her occupational therapist, you plan to address both the psychological and practical aspects of her condition. Ways the most effective approach to helping Mrs. Rodriguez regain independence. Improve her mental health. A. Encouraging Mrs. Rodriguez to participate in group therapy sessions with others who have similar conditions to build social support. B. Developing a graded activity plan that includes small, manageable goals and gradually increasing her participation in self-care and leisure activities. C. Focusing exclusively on cognitive behavioral therapy (CBT) to address her depressive symptoms without integrating any physical or occupational tasks. Recommending that Mrs. Rodriguez seek psychiatric counseling in addition to medication management, but not incorporate any therapeutic activities in her daily routine. Answer. B. Developing a graded activity plan that includes small, manageable goals and gradually increasing her participation in self-care and leisure activities. Explanation. A graded activity plan is an effective strategy for addressing both the physical and psychosocial aspects of depression. By breaking tasks into smaller, manageable goals, the therapist can help Mrs. Rodriguez build confidence and motivation to engage in daily activities again. The approach not only improves functional independence but also provides a sense of accomplishment, which can have positive effects on mood. Encouraging participation in group therapy A may be helpful for social support but does not directly address Mrs. Rodriguez's functional goals in daily living. Focusing solely on cognitive behavioral therapy (CBT) C would neglect the physical aspects of recovery and miss an opportunity to improve functioning. Recommending psychiatric counseling alone D may address the emotional components of depression but would not enhance Mrs. Rodriguez's ability to regain functional independence. Question 6. Occupational therapy process. During a follow-up session with a patient, Mr. Hill, who has been undergoing therapy for a shoulder injury, you notice that his range of motion and strength are improving, but he continues to report pain and difficulty performing work-related tasks that require overhead reaching. His goals have not been fully met yet. Given the progress and the ongoing limitations in function, which of the following strategies are most appropriate for modifying the treatment plan to optimize outcomes? A. Continue with the same interventions for range of motion and strength without addressing the pain complaints, as they are likely part of the recovery process. B. Modify the current therapy program by incorporating specific interventions for pain management. such as therapeutic modalities and activity modification while still focusing on strength and mobility. C. Discharge Mr. Hill from therapy as he has made significant progress with range, motion and strength. D. Increase the intensity and frequency of the current exercises as more aggressive rehabilitation is likely to resolve the pain and functional limitations. Answer. B. Modify the current therapy program by incorporating specific interventions for pain management, such as therapeutic modalities and activity modification, while still focusing on strength and mobility. Explanation. Mr. Hill's ongoing pain despite progress in range of motion and strength suggests that pain management interventions should be incorporated into the treatment plan. Interventions such as therapeutic modalities, e.g., heat, cold ultrasound, can help alleviate pain, while activity modification can ensure that he is not overexerting himself or exacerbating the injury. Balancing pain management with continued work on strength and mobility will optimize overall function and improve outcomes. Continuing with the same interventions without addressing pain may delay recovery and prevent functional improvement. Discharging Mr. Hill C is premature as he has not yet achieved full functional recovery and pain is still a limiting factor. Increasing the intensity and frequency of exercises D could exacerbate his pain and hinder progress, especially if pain is not addressed in the treatment plan. Question 7. Therapeutic communication and interpersonal skills during a session with Mr. Allen, a 68-year-old man recovering from a stroke. You notice he is becoming frustrated and resistant to participating in the therapy activities. He expresses feelings of helplessness and a lack of progress, saying that therapy is not helping. As his occupational therapist, what approach would be most effective in addressing Mr. Allen's emotional response, improving his engagement in therapy? A. Redirecting the conversation away from his feelings and focusing solely on the physical exercises to avoid discussing emotions. B. Acknowledging Mr. Allen's feelings, expressing empathy, and exploring his concerns about the therapy process to build trust and motivation. C. Telling Mr. Allen that many patients feel frustrated during recovery and he needs to push through it to get better. D. Minimizing the significance of his feelings by suggesting frustration is common and that he will eventually feel better with time. Answer. B. Acknowledging Mr. Allen's feelings, expressing empathy, and exploring his concerns about the therapy process to build trust and motivation. Explanation. In this scenario, acknowledging and validating Mr. Allen's feelings is essential for building trust and establishing strong therapeutic relationship. Expressing empathy demonstrates understanding of his frustration and provides an opportunity to explore any concerns he may have about the therapy process. Addressing emotional responses in constructive and supportive way can increase the patient's motivation to engage in treatment. Redirecting the conversation may shut down communication and miss the opportunity to address emotional concerns that are affecting therapy engagement. Telling Mr. Allen to push through C can be dismissive and may damage the therapeutic relationship by invalidating his feelings. Minimizing his feelings D might make Ms. Allen feel unheard and could contribute to lack of trust or motivation to continue with therapy. Question 8. Physical dysfunction. A 55-year-old male client, Mr. Simmons, has sustained a traumatic brain injury (TBI) in a motor vehicle accident and is in the acute phase of recovery. He's showing signs of cognitive impairment, including memory difficulties, poor attention span, and difficulty following multi-step instructions. He also has some motor impairments, including weakness on his left side and difficulty with balance. Following intervention strategies would be most effective for promoting Mr. Simmons' functional independence and cognitive recovery during this phase of rehabilitation. A. Focusing primarily on improving his physical strength and balance without addressing his cognitive impairments. B. Implementing combination of physical and cognitive exercises such as task-oriented practice that integrates motor and cognitive skills. C. Focusing only on cognitive exercises to improve his attention span and memory, disregarding his physical limitations. D. Encouraging Mr. Simmons to engage in social activities and therapy sessions to focus on emotional recovery before addressing his physical and cognitive needs. Answer. B. Implementing a combination of physical and cognitive exercises such as task-oriented practice that integrates motor and cognitive skills. The explanation. In the case of a traumatic brain injury (TBI), a combination of physical and cognitive rehabilitation is necessary. Integrating motor and cognitive exercises into daily tasks promotes functional independence by addressing both aspects of recovery simultaneously. For example, using task-oriented practice that requires following multi-step instructions while engaging in physical activities, e.g. dressing, preparing meals, can help improve memory, attention, and physical function. Focusing only on physical strength and balance, or cognitive exercises alone would neglect one of the client's needs, limiting overall progress in both domains. Encouraging social activities in group therapy D may be beneficial for emotional recovery, but is not sufficient on its own, as Mr. Simmons requires comprehensive rehabilitation to address both physical and cognitive impairments. Question 9. Development across the lifespan. As part of an early intervention program, you are working with a 2-year-old child, Emily, who is showing delays in language and motor development. She is not yet speaking in 2 to 3-word phrases and is showing difficulty with gross motor tasks, such as running and climbing. After conducting a thorough assessment, you decide to implement an intervention plan. What is the most appropriate intervention to support Emily's development in both areas? A. Focusing solely on speech therapy to address her language delays, as this is the primary area of concern. B. Implementing play-based therapy program that promotes both language development and motor skills through activities like pretend play, climbing, and social interaction. C. Focusing only on gross motor activities such as running and climbing to encourage physical development without addressing language delays. D. Providing Emily individual therapy sessions for both language and motor skills separately, rather than integrating both areas into one program. Answer. B. Implementing a play-based therapy program that promotes both language development and motor skills through activities like pretend play, climbing, and social interaction. Explanation. Play-based therapy is an effective intervention strategy for children in the early developmental stages. By using play, therapists can address both language and motor delays simultaneously, as many play activities naturally integrate language and motor development. Activities such as pretend play, climbing, and engaging with peers help improve both language skills, e.g. through communication during play, and gross motor skills, e.g. through physical activity. Focusing solely on speech therapy or gross motor activities, C, does not address the holistic nature of child development and may leave one area untreated. Providing individual therapy sessions separately, D, does not take advantage synergistic effects of integrated activities that can target both domains of development. Question 10. Safety and infection control. You are working in a rehabilitation facility and you notice that some of the equipment used in therapy sessions is becoming contaminated with dirt and sweat from clients. Which of the following actions should you take to ensure proper infection control and maintain a safe environment for both clients and staff? A. Clean the equipment at the end of each therapy session with a standard household cleaner. B. Use appropriate disinfectants according to the facility's infection control policies and clean the equipment after each use. C. Ask clients to clean the equipment before and after using it to ensure cleanliness. D. Only clean the equipment if it is visibly soiled, as cleaning it after each use would be unnecessary and time-consuming. Answer. B. Use appropriate disinfectants according to the facility's infection control policies and clean the equipment after each use. Explanation. Proper infection control practices are critical in healthcare settings to prevent the spread of infections. The correct approach is to use disinfectants that are proven effective in eliminating harmful pathogens, as outlined in the facility's infection control policies. Cleaning the equipment after each use ensures cross-contamination does not occur, protecting both clients and staff. Using household cleaners may not meet the necessary infection control standards for healthcare environments. Asking clients to clean the equipment, C, may not guarantee proper disinfection and can lead to inconsistent cleaning practices. Cleaning only when visibly soiled, D, is not sufficient, as pathogens can still be present on surfaces that appear clean, posing risk of infection. Question 11. Assistive technology. A client, MS Thompson, who has severe rheumatoid arthritis, is struggling with her ability to open jars and bottles, which impacts her ability to independently prepare meals. As her occupational therapist, you decide to explore the use of assistive technology to help with this task. Which of the following assistive devices would be most appropriate for MS Thompson to improve her ability to open and regain independence in meal preparation? A jar opener with adjustable grips that can be easily adapted for different sizes of containers. B. An electric opener that requires minimal hand strength for opening cans. C. A universal cuff that allows Ms. Thompson to hold objects while using one hand to manipulate the task. D. A large, ergonomic jar opener with a built-in motor to automatically open containers with minimal physical effort. Answer A. A jar opener with adjustable grips that can be easily adapted for different sizes of containers. Explanation. A jar opener with adjustable grips is an effective assistive device for Ms. Thompson because it is specifically designed to help individuals with limited grip strength, like those with rheumatoid arthritis, to open a variety of containers. The adjustable grips ensure that the device can be adapted for different jar and bottle sizes, making it versatile for her needs. An electric opener B might help with cans, but does not address the broader issue of opening jars and bottles. A universal cuff C could be useful for stabilizing objects, but it does not directly address the issue of opening containers and might not provide the specific leverage needed for jar lids. A motorized jar opener D may be useful but could be unnecessarily complex and costly for the task at hand. The adjustable manual opener is a more practical and accessible solution. Question 12. Cognitive rehabilitation. You are working with a client, Mr. White, who has experienced a traumatic brain injury to BI. He has difficulty with memory and attention, making it hard for him to recall instructions and complete tasks independently. As part of his rehabilitation, which cognitive rehabilitation strategy would most effectively support his ability to improve task performance and enhance his daily functioning? A. Providing verbal instructions only, as this helps Mr. White focus on auditory processing. B. Using written cues and reminders to supplement verbal instructions and help him stay on task. C. Encouraging Mr. White to work independently without any external prompts, as this will help him regain cognitive abilities more quickly. D. Focusing solely on memory exercises, as improving memory function will directly impact task performance. Answer. B. Using written cues and reminders to supplement verbal instructions and help him stay on task. Explanation. Using written cues and reminders is a proven cognitive rehabilitation strategy for individuals with memory and attention deficits, especially after a traumatic brain injury to BI. Written cues can act as external prompts to reinforce verbal instructions and support task completion. This approach helps improve performance by providing a clear, visible reference for the client. Providing only verbal instructions, they may be challenging for Mr. White due to his memory difficulties. He is likely to benefit from additional support in the form of written cues. Encouraging independent work without prompts, C, could be overwhelming and counterproductive for someone with memory and attention deficits. Focusing only on memory exercises, D, would neglect the input for supporting attention and other cognitive functions necessary for task performance. Question 13. Geriatric occupational therapy. Mrs. Lawrence is a 78-year-old woman who has been living independently in her own home but is now experiencing some mobility issues related to osteoarthritis. She has expressed concern about falling, especially when moving between rooms or standing up from chairs. As her occupational therapist, what is the most appropriate intervention to help Mrs. Lawrence improve her safety and maintain her independence? A. Recommend that Mrs. Lawrence move into an assisted living facility to ensure her safety. B. Provide adaptive equipment, such as grab bars and a raised toilet seat to improve safety during transfers and toileting. C. Encourage Mrs. Lawrence to stop performing any tasks that require standing, as this will prevent her from falling. D. Develop a home modification plan, including removing trip hazards, improving lighting, and installing devices like grab bars to support her mobility and reduce fall risk. Answer. D. Develop a home modification plan, including removing trip hazards, improving lighting, and installing assistive devices like grab bars to support her mobility and reduce fall risk. Explanation. A comprehensive home modification plan is the most effective way to reduce the risk of falls and maintain Mrs. Lawrence's independence. This approach focuses on improving her environment by addressing potential hazards, such as trip, inadequate lighting, and lack of supportive devices. Installing grab bars and improving the lighting can make it safer for her to move around and perform tasks independently. Recommending an assisted living facility A might not be necessary if Mrs. Lawrence can still live independently with appropriate modifications and support. Providing adaptive equipment B is part of the solution but should be implemented alongside other home modifications to address the environment as a whole. Stopping all standing tasks C would limit Mrs. Lawrence's independence and overall quality of life. Encouraging safe mobility through home modifications is better approach. Question 14. Mental health and occupational therapy. You are working with a client, Mrs. Carter, who has been diagnosed with severe anxiety. She reports feeling overwhelmed by daily responsibilities and has difficulty engaging in tasks that she used to enjoy. She expresses frustration with her lack of motivation and is seeking help to regain some sense of control in her life. Which of the following therapeutic interventions would be most beneficial for Mrs. Carter in managing her anxiety and improving her ability to engage in daily tasks? A. Encouraging Mrs. Carter to push through her anxiety and complete all tasks as scheduled to build resilience. B. Introducing mindfulness techniques such as deep breathing and guided imagery to reduce stress and help her focus on the present moment. C. Focusing solely on completing tasks without addressing the emotional components of her anxiety. D. Recommending that Mrs. Carter take medication to manage her anxiety but not offering therapeutic interventions. Answer. B. Introducing mindfulness techniques such as deep breathing and guided imagery to reduce stress and help her focus on the present moment. Explanation. Mindfulness techniques are effective interventions for individuals with anxiety as they help reduce stress and promote relaxation. Techniques such as deep breathing and guided imagery can help Mrs. Carter focus on the present moment, calm her anxiety, and regain a sense of control over emotions. These strategies also help improve her ability to engage in daily activities by reducing the overwhelming feelings that interfere with task completion. Encouraging Mrs. Carter to push through anxiety without addressing the emotional aspects of her condition may increase her distress and make it harder for her to engage in tasks. Focusing solely on tasks C without addressing the anxiety would neglect the root cause of her difficulties and could lead further frustration. Recommending medication alone D might help manage her anxiety symptoms, but combining this with therapeutic interventions like mindfulness will provide a more holistic approach to her recovery. Question 15. Pediatric occupational therapy. You are working with a 5-year-old child, Kyle, who has been diagnosed with a sensory processing disorder, SPD. It becomes easily overwhelmed by loud noises and bright lights, and this affects his ability to participate in school activities. As his occupational therapist, which of the following interventions would be most appropriate for helping Kyle manage his sensory sensitivities and improve participation in school? A. Encourage Kyle to avoid all sensory stimuli such as noise and bright lights to prevent discomfort. B. Implement a sensory diet that includes structured activities to help Kyle gradually tolerate sensory input and improve self-regulation. C. Focus exclusively on cognitive behavioral therapy (CBT) to address Kyle's emotional reactions to sensory stimuli. D. Recommend that Kyle be removed from noisy or brightly environments to help him focus on academic tasks. Answer. B. Implement a sensory diet that includes structured activities to help Kyle gradually tolerate sensory input and improve self-regulation. Explanation. A sensory diet is an individualized set of activities designed to help children with sensory processing disorders gradually tolerate sensory input by introducing structured activities that target sensory processing skills, such as exposure to various textures, sounds, or light. Controlled ways, Kyle can learn to self-regulate and improve his participation in school activities. Encouraging Kyle to avoid all sensory stimuli may provide short-term relief, but does not address his sensory processing difficulties and can limit his ability to function in different environments. Focusing exclusively on cognitive behavioral therapy (CBT) may be helpful for emotional regulation, but does not directly to sensory processing issues. Removing Kyle from noisy or brightly lit environments (D) may provide temporary relief, but will not help him develop strategies to manage sensory sensitivities in the long term. Question 16. Pediatric occupational therapy. Liam is a 7-year-old child diagnosed with developmental coordination disorder (DCD), often referred to as dyspraxia. His parents are concerned about his difficulty with fine motor skills, such as tying his shoes, writing, and using utensils. As his occupational therapist, which intervention strategy would be most beneficial to help Liam improve his fine motor coordination? Independence in daily activities. A. Focus exclusively on hand strengthening exercises to build the muscles needed for fine motor tasks. B. Introduce task-specific practice, breaking down activities like shoe tying and writing into smaller, manageable steps. C. Encourage Liam to use adaptive tools, such as oversized pens or special utensils, to avoid frustration. D. Recommend that Liam limit his participation in tasks that require fine motor skills to reduce anxiety. Answer. B. Introduce task-specific practice, breaking down activities like shoe tying and writing into smaller, manageable steps. Explanation. Task-specific practice involves breaking down complex activities into smaller, more manageable steps. This allows Liam to build his fine motor coordination, gradually enhancing his independence in tasks such as shoe tying and writing. Focusing solely on hand-strengthening exercises is not as effective. Using task-specific practice to address the functional aspects of fine motor coordination. Using adaptive tools, C might reduce frustration temporarily, but it may not fully address the underlying coordination difficulties that Liam faces. Limiting participation in fine motor tasks, D, may decrease his opportunities for improvement and hinder his development. Question 17. Geriatric occupational therapy. Mrs. Clark is an 82-year-old woman who has been experiencing increasing difficulty with her balance and mobility due to age-related changes and osteoporosis. She has had a recent fall but is determined to continue living independently in her home. As her occupational therapist, what would be the most effective intervention to help Mrs. Clark improve her safety and mobility in home environment? A. Encourage Mrs. Clark to limit her physical activity to avoid the risk of falling. B. Conduct a home safety evaluation and recommend modifications such as grab bars and non-slip rubs. C. Recommend that Mrs. Clark move to a nursing home for better supervision and support. D. Focus only on strength building exercises without considering her home environment. Answer. B. Conduct a home safety evaluation and recommend modifications such as grab bars and non-slip rugs. Explanation. A home safety evaluation allows the occupational therapist to identify potential hazards in Mrs. Clark's living environment and recommend modifications that enhance her safety. Installing grab bars and non-slip rugs can prevent falls and make her home more navigable. Limiting physical activity. A. Counterproductive, as regular physical activity is important for maintaining strength and mobility, especially for older adults. Recommending nursing home. C. May be unnecessary if Mrs. Clark can remain independent with appropriate modifications and support. Focusing only on strength-building exercises. D. Without addressing the home environment misses an important aspect of fall prevention and safety. Question 18. Mental health and occupational therapy. John, a 35-year-old man, has been diagnosed with severe depression and expresses feelings of hopelessness. He has withdrawn from activities he once enjoyed and has difficulty completing daily tasks due to his lack of motivation. As his occupational therapist, what intervention would be most effective in helping John regain a sense of accomplishment and improve his engagement in daily life? I encourage John to engage in a variety of activities without focusing on how he feels, as action would eventually improve his mood. B. Introduce graded activity scheduling, where John gradually increases his participation in enjoyable and meaningful tasks. C. Suggest that John take a break from all responsibilities and focus solely on rest and relaxation. D. Focus exclusively on cognitive behavioral therapy (CBT). Address the emotional aspects of his depression. Correct answer. B. Introduce graded activity scheduling, where John gradually increases his participation in enjoyable and meaningful tasks. Explanation. Graded activity scheduling is an effective intervention for individuals with depression. By gradually increasing participation in enjoyable and meaningful activities, John can build a sense of accomplishment and combat his lack of motivation. This approach allows him to re-engage with life at a manageable pace. Encouraging activity without focusing on feelings can be overwhelming for someone with severe depression and may not address the underlying emotional barriers. Suggesting that John take a break from all responsibilities. C. May temporarily alleviate stress, but it doesn't promote long-term recovery or engagement in meaningful activities. Focusing solely on CBT can help with emotional regulation, but should be combined with practical strategies to enhance engagement in daily tasks. Question 19. Assistive technology. Sarah, a 12-year-old girl with cerebral palsy, has limited hand function and is struggling with her ability to complete school assignments that require writing. As her occupational therapist, what assistive technology intervention would be most helpful in supporting Sarah's academic success and enhancing her independence in completing her assignments? A. Provide laptop with speech-to-text software, so Sarah can dictate her assignments instead of writing by hand. B. Recommend that Sarah switch to oral presentations for all of her assignments to avoid the need for writing. C. Provide specialized pen that amplifies Sarah's grip strength for better control while writing. D. Encourage Sarah to rely on her parents for completing her written assignments to ensure they are finished correctly. Answer: A. Provide a laptop with speech-to-text software so Sarah can dictate her assignments instead of writing by hand. Explanation: speech-to-text software is a powerful tool for individuals with limited hand function, allowing them to dictate their thoughts and complete written assignments without relying on handwriting. This promotes independence and academic success for Sarah, recommending oral presentations. B. Limits Sarah's opportunities to engage written assignments and may not fully address her educational needs. Providing specialized pen. C. May improve handwriting to some extent, but it does not address the core issue of limited hand function. Encouraging parental assistance. D. May undermine Sarah's independence and her ability to complete tasks on her own. Question 20. Pediatric occupational therapy. Emily is a 4-year-old child with autism spectrum disorder who has difficulty with social interactions and self-regulation. She often becomes overwhelmed in noisy or crowded environments, leading to meltdowns. As her occupational therapist, which intervention would be most effective in helping Emily improve her ability to manage sensory overload and enhance her social participation? A. Encourage Emily to avoid social interactions and crowded places to prevent overwhelming situations. B. Introduce sensory regulation strategies such as deep pressure or calming activities to help Emily manage her sensory sensitivities. C. Recommend that Emily attend social skills training programs without addressing her sensory needs. D. Focus exclusively on behavior modification techniques to reduce Emily's meltdowns. Answer: B. Introduce sensory regulation strategies such as deep pressure or calming activities to help Emily manage her sensory sensitivities. Explanation: sensory regulation strategies are crucial for children with autism spectrum disorder, especially those who experience sensory overload. Techniques like deep pressure or calming activities can help Emily regulate her sensory sensitivities, preventing meltdowns and improving her ability to engage in social interactions. Encouraging avoidance of social interactions, it may limit Emily's opportunities to develop social skills and become accustomed to different environments. Social skills training, C, is important, but it must be paired with sensory regulation strategies to address the underlying sensory sensitivities that contribute to Emily's distress. Behavior modification, D, is not sufficient on its own if sensory sensitivities are addressed first. Question 21. Cognitive rehabilitation. Daniel, a 45-year-old man, suffered a stroke that resulted in moderate cognitive impairments, particularly in memory and attention. He is struggling to complete daily tasks at home, such as managing his finances and remembering important appointments. As his occupational therapist, which intervention would be most effective in supporting Daniel's cognitive rehabilitation and improving his independence? I encourage Daniel to rely on his spouse for all daily tasks to reduce his cognitive load. B. Introduce compensatory strategies, such as using calendar and reminder system to support memory and organization. C. Recommend that Daniel return to work immediately to help him regain cognitive function through real-world challenges. D. Focus exclusively on memory exercises without considering other cognitive aspects, such as attention, organization. Answer: B. Introduce compensatory strategies such as using a calendar and reminder system to support memory and organization. Explanation: compensatory strategies such as a calendar and reminder system can help Daniel manage memory and attention deficits, allowing him to function more independently in daily life. These strategies provide external support to help him stay organized and on track without overwhelming him. Relying on Tausay may be helpful short-term, but does not promote Daniel's independence and may limit his ability to regain functional skills. Returning to work immediately, C, might be too challenging and could increase Daniel's stress without addressing his current cognitive limitations. Focusing only on memory exercises, D, overlooks other cognitive domains, such as attention and organization, which are equally important for his independence. Question 22. Sensory processing disorder. Ben, a 9-year-old boy with sensory processing disorder (SPD), has difficulty tolerating certain textures and sounds. He avoids wearing certain clothes, refuses to eat foods with certain textures, and becomes upset in noisy environments. As his occupational therapist, what intervention would be most effective in helping Ben improve his tolerance to sensory input and participate more fully in activities? A. Avoid exposing Ben to any sensory stimuli that cause distress. B. Gradually introduce sensory experiences in a controlled manner to help Ben build tolerance. C. Encourage Ben to adapt to sensory experiences without any interventions or support. D. Focus exclusively on providing sensory integration therapy to address all of Ben's sensory needs. Answer: B. Gradually introduce sensory experiences in a controlled manner to help Ben build tolerance. Explanation: gradual controlled exposure to sensory experiences is a key strategy for helping children with sensory processing disorder (SPD) build tolerance. By slowly introducing new textures, sounds, and experiences, Ben can learn to manage his sensitivities in a safe and structured manner, improving his participation in activities. Avoiding sensory stimuli entirely limits Ben's opportunities to gradually build tolerance and adapt to his environment. Encouraging Ben to adapt without support, C, can be overwhelming and ineffective without the necessary guidance and support. Sensory integration therapy, D, is a valuable approach, but it should be part of a comprehensive plan that includes gradual exposure to sensory experiences. Question 23. Geriatric occupational therapy. Mr. Adams, a 75-year-old man with dementia, has been struggling with his ability to perform activities of daily living. Adults such as dressing, grooming, and bathing. His wife, who is his primary caregiver, is becoming overwhelmed by the increasing demands of caregiving. As his occupational therapist, what intervention would be most effective in supporting both Mr. Adams and his wife? A. Recommend that Mr. Adams move to a long-term care facility to relieve his wife's caregiving burden. B. Provide adaptive equipment, such as button, hooks, and a shower chair to support Mr. Adams' independence in adults. C. Focus solely on memory exercises to improve Mr. Adams' cognitive abilities without considering his adults. D. Encourage his wife to perform all tasks for Mr. Adams to ensure they are completed correctly. Answer: B. Provide adaptive equipment, such as button, hooks, and a shower chair to support Mr. Adams' independence in adults. Explanation: providing adaptive equipment can enhance Mr. Adams' independence in daily activities, allowing him to maintain his dignity and reduce the caregiving burden on his wife. Devices like button, hooks for dressing, and shower chair for bathing can make these tasks more manageable for both Mr. Adams and his wife. Recommend long-term care facility. A. May be necessary if Mr. Adams' care needs increase, but adaptive equipment can help him remain at home longer. Focusing only on memory exercises. C. Without addressing practical adult needs would leave his functional independence unsupported. Encouraging his wife to perform all tasks for him. D. Might seem helpful but can increase caregiver burnout and hinder Mr. Adams' independence. Question 24. Cognitive rehabilitation. Olivia, a 28-year-old woman, has experienced cognitive decline due to multiple sclerosis (MS). She has difficulty with multitasking, following complex instructions, and remembering appointments. As her occupational therapist, what is the most appropriate intervention to improve Olivia's cognitive function and help her manage daily tasks? A. Encourage Olivia to push through the cognitive challenges without any support to strengthen her cognitive skills. B. Introduce strategies for task simplification and use external tools like planners to aid in memory and task management. C. Recommend Olivia to avoid complex tasks entirely to reduce frustration. D. Focus exclusively on strengthening exercises to improve cognitive function. Answer: B. Introduce strategies for task simplification and use external tools like planners to aid in memory and task management. Explanation: task simplification and the use of external tools such as planners or reminder systems are key strategies in cognitive rehabilitation for individuals with cognitive decline. These interventions help Olivia manage daily tasks more effectively by reducing cognitive overload and providing support for memory and task organization. Encouraging Olivia to push through challenges without support may lead to frustration and hinder her progress, especially with cognitive difficulties. Avoiding complex tasks. C. Entirely may limit Olivia's opportunities to engage in meaningful activities, and it does not promote cognitive growth or adaptation. Focusing only on strengthening exercises. D. Will not address the specific cognitive impact Olivia is facing, such as difficulties with multitasking and memory. Question 25. Pediatric occupational therapy. James, a 6-year-old child with a diagnosis of attention deficit hyperactivity disorder (ADHD), is struggling to focus on his schoolwork and often exhibits disruptive behaviors in the classroom. He has trouble remaining seated and is frequently distracted by environmental stimuli. As his occupational therapist, which intervention would be most effective in helping James improve his attention and self-regulation in the classroom? A. Encourage James to sit at the back of the classroom to reduce distractions and focus on individual tasks. B. Introduce sensory breaks and self-regulation strategies, such as fidget tools or movement activities, to help James stay engaged. C. Recommend that James be placed in A separate classroom environment with fewer distractions to ensure better focus. D. Suggests that James take medication to improve his attention without behavioral strategies. Answer: B. Introduce sensory breaks and self-regulation strategies, such as fidget tools or movement activities, to help James stay engaged. Explanation: sensory breaks and self-regulation strategies like using fidget tools or allowing brief movement activities help children with ADHD manage their energy levels and improve attention. These interventions provide an outlet for restlessness, helping James stay engaged and focused during tasks. Sitting at the back of the classroom might reduce some distractions, but it doesn't address the root causes of his attention issues. Placing James in separate classrooms C could help with fewer distractions, but it might isolate him and doesn't address the need for self-regulation in different environments. Medication D may be beneficial for ADHD, but behavioral strategies should be incorporated to improve long-term skills and engagement. Question 26. Geriatric occupational therapy. Mrs. Thompson, a 78-year-old woman, has experienced a recent hip fracture and is undergoing rehabilitation. She is motivated to regain her independence but is concerned about the pain she experiences while moving and the risk of re-injury. As her occupational therapist, which intervention would be most beneficial in supporting Mrs. Thompson's recovery and improving her quality of life? A. Focus only on strengthening exercises to improve her physical abilities without considering pain management. B. Provide education on energy conservation techniques and adaptive equipment, such as reaches and grab bars, to minimize the risk of falls. C. Recommend that Mrs. Thompson refrain from any physical activity until her pain subsides. D. Encourage Mrs. Thompson to rely on her family members for all mobility and daily to avoid the risk of re-injury. Answer: B. Provide education on energy conservation techniques and adaptive equipment, such as reaches and grab bars, to minimize the risk of falls. Explanation: energy conservation techniques and adaptive equipment can help Mrs. Thompson maintain her independence while managing her pain and minimizing the risk of re-injury. These strategies ensure that she can perform daily tasks more safely without overexerting herself. Focusing only strengthening exercises without addressing pain management and safety concerns may cause further discomfort and limit her participation in rehabilitation. Refraining from physical activity C entirely is not advisable, as movement is essential for her recovery and preventing complications like stiffness. Encouraging Mrs. Thompson to rely on family members D undermines her independence and may limit her progress in regaining functional abilities. Question 27. Pediatric occupational therapy. Sophia, an 8-year-old girl, has a diagnosis of dyspraxia, which affects her coordination and motor planning abilities. She is struggling with tasks such as writing, using scissors, and buttoning her clothes. As her occupational therapist, which intervention would be most effective in helping Sophia improve her motor skills and independence? A. Provide her with specialized writing tools and adaptive clothing, such as Velcro shoes, to bypass the need for improving motor skills. B. Focus on motor skill practice through structured activities, such as games that involve cutting, drawing, and buttoning, to improve hand-eye coordination. C. Recommend that Sophia avoid tasks that require fine motor skills to reduce frustration and anxiety. D. Encourage Sophia to use assistive technology to perform daily tasks instead of addressing the underlying motor planning difficulties. Answer: B. Focus on motor skill practice through structured activities, such as games that involve cutting, drawing, and buttoning, to improve hand-eye coordination. Explanation: motor skill practice through structured activities is the most effective way to address Sophia's motor planning and coordination difficulties. Activities like cutting, drawing, and buttoning can improve her fine motor skills and hand-eye coordination, allowing her to perform daily tasks independently. Specialized writing tools and adaptive clothing might help temporarily, but don't address the underlying issues related to motor coordination. Avoiding tasks that require fine motor skills C will limit Sophia's opportunities to improve her motor skills and hinder her development. Assistive technology D might assist with task completion but does not help Sophia overcome her motor planning challenges in the long term. Question 28. Cognitive rehabilitation. Tom, a 50-year-old man, has suffered a traumatic brain injury (TBI) and is experiencing difficulties with attention, memory, and executive function. He has trouble organizing his day, following through on tasks, and managing appointments. as his occupational therapist, what intervention would be most effective in supporting Tom's cognitive rehabilitation and improving his functional independence? A. Introduce structured daily routine and use external memory aids, such as calendars, to help Tom stay organized. B. Focus on executive function training exclusively without considering the role of memory in daily functioning. C. Recommend that Tom reduce his responsibilities at home and work to focus solely on cognitive rehabilitation. D. Encourage Tom to rely on family members for managing his schedule and appointments. Answer. A. Introduce a structured daily routine and use external memory aids, such as calendars, to help Tom stay organized. Explanation. A structured daily routine combined with external memory aids, such as calendars, can significantly improve Tom's ability to stay organized and manage his daily tasks. These tools help compensate for cognitive impairments related to memory and attention, promoting greater independence in daily activities. Executive function training (B) is important but should be integrated with memory and organizational strategies to address all aspects of Tom's cognitive needs. Reducing responsibilities (C) might limit Tom's opportunities to practice functional independence and adjust to the cognitive challenges he faces. Relying on family members (D) may be helpful in the short term, but does not promote Tom's autonomy or encourage cognitive adaptation. Question 29. Sensory integration therapy. Lily, a 4-year-old child, has been diagnosed with sensory processing disorder (SPD). She is hypersensitive to touch and becomes distressed when exposed to certain textures, such as clothing tags or certain foods. As her occupational therapist, which intervention would be most effective in helping Lily manage her sensory sensitivities? A. Gradually expose Lily to the uncomfortable textures in a controlled manner to help her build tolerance over time. B. Encourage Lily to avoid all stimuli that trigger her sensitivities to prevent overwhelming her. C. Recommend sensory integration therapy that focuses solely on auditory processing without considering tactile sensitivities. D. Suggest that Lily wear only clothes made from soft fabrics and eat only bland foods to min distress. Answer. A. Gradually expose Lily to the uncomfortable textures in a controlled manner to help her build tolerance over time. Explanation. Gradual, controlled exposure to challenging textures helps children with sensory processing disorder (SPD) build tolerance and adaptability. This approach enables Lily to adjust to various textures and become less distressed by them. Avoiding all stimuli (B) limits Lily's opportunities to adapt and doesn't address underlying sensory sensitivities. Sensory integration therapy for only auditory processing (C) may help with one aspect of sensory processing but should be part of a broader plan that also addresses tactile sensitivities. Wearing specific clothes and eating only bland foods (D) might reduce distress in the short term but does not promote long-term adaptation to a variety of textures. Question 30. Cognitive rehabilitation for older adults. Mr. Harris, a 72-year-old man, has been diagnosed with mild cognitive impairment (MCI). He is experiencing difficulties with short-term memory, such as forgetting appointments and misplacing items, but he can still perform daily activities independently. As his occupational therapist, which intervention would be most effective in improving Mr. Harris's memory and helping maintain his independence? A. Recommend that Mr. Harris stop performing memory-intensive activities and focus on routine tasks to avoid frustration. B. Introduce memory aids, such as electronic reminders and daily checklist, to help Mr. Harris stay organized and remember appointments. C. Focus on cognitive retraining exercises exclusively without addressing his need for support in daily activities. D. Encourage Mr. Harris to rely on family members, reminders, and managing his schedule. Answer. B. Introduce memory aids, such as electronic reminders and a daily checklist to help Mr. Harris stay organized and remember appointments. Explanation. Memory aids like electronic reminders and checklists are effective tools for supporting individuals with mild cognitive impairment (MCI). These tools help reduce memory-related challenges and improve organization, allowing Mr. Harris to maintain his independence while managing cognitive difficulties. Avoiding memory-intensive activities limits opportunities for cognitive engagement, which is important for maintaining function. Cognitive retraining exercises (C) are beneficial but should be combined with practical strategies like memory aids to promote overall independence and daily functioning. Relying on family members (D) for reminders may provide short-term relief but does not encourage Mr. Harris to compensatory strategies that can help him remain independent.